Welcome viewer. Assalamu alaikum. Today I want to discussion in brief meningitis. First we know what is meninges. Meninges, durameter, arachnoid meter and pyometer. Inflammation or infection of the meninges, the membrane that surrounds the brain and the spinal cord, it is meningitis. And inflammation of the brain itself, it is encephalitis. If both meningoencephalitis. Meningococcal disease is a potential life-threatening infection. Meningococcal disease first described 1805 when an outbreak swept through Geneva, Switzerland. And causative agent Nigeria meningitis first identified 1887. Meningitis, the symptom fever, neck pain, sleepiness, vomiting, joint pain, rash, headache, seizure, light sensitivity. Different type meningitis by bacterial, fungal, viral. The symptoms which appear first: shivering, chill, fever, cold, hand, feet, skin color change, certain severe pain in the arm, leg, neck, and fever, thirst, nausea, vomiting, maybe diarrhea, drowsiness, loss of consciousness, rapid breathing, and pinprick rash, develop purple plus. Meningococcal meningitis severe headache, stiff or painful neck, sensitivity to light, drowsiness, loss of consciousness, fits, seizure, and rash. Early diagnosis and managing is the first principle for meningitis treatment. Bacterial meningitis can enter through our nasal orifice, our oropharynx, and internal ear infection. Fever although not present in the neonate, but vomiting, nausea, lethargy, irritable, refusing feeding, drink, headache, muscle pain, joint pain, respiratory symptom, sign of breathing difficulty. The rash, if we press it not fades away, non-blanching rash. Is the incidence, how many patients throughout the year. Brudzinski sign, neck sign, if we neck folding, try to on the chest tossing, it is unable, and pain on the leg. We examine eye, ear, blood test, lumbar puncture, EG, CT, MRI or X-ray. Cardiac sign positive when patient lying with thigh flexed on the abdomen, the leg cannot be completely extended. The normal brain, and this the meningitis brain. Fulminant hemorrhagic necrotizing meningoencephalitis. Streptococcus pneumonia, Haemophilus influenza, Nigeria meningitis, Listeria monocytogenes, the common organism. Less than 3 months, group B Streptococcus, gram-negative bacilli, Streptococcus, Nigeria meningitis. More than 3 months to 3 years, Streptopneumonia, Nigeria meningitis, group B Streptococcus, gram-negative bacilli. 3 to 10 years, Streptopneumonia, Nigeria meningitis, and above 10 years, main organism Nigeria meningitis. Routine investigation, full blood count, CRP, coagulation screen, blood culture, whole blood polymerase, PCR for meningitis, blood glucose, special examination for CSF, specific bacterial antigen test, countercurrent immunoelectrophoresis, latex agglutination, immunofluorescence test for meningitis, Nigeria meningitis, Haemophilus influenza, Streptococcus pneumonia, group B Streptococcus. If clinical picture, the raised intracranial pressure, level of consciousness is the below 9 or 3, relative bradycardia, hypertension, focal neurological sign, abnormal posture, unequal dilated, poorly response people, papillary edema, abnormal dull eye movement, shock, extensive spreading purpura, If the patient is shocked, extensive spreading purpura after convulsion until stabilized, coagulation abnormality, coagulation result outside the normal range, platelet count below. No need any skin scraping, skin biopsy, petechial purpura lesion, need to blood culture or CSF culture or PCR test for meningitis, need indication for lumbar puncture, diagnosis central nervous system, diagnosis subarachnoid hemorrhage evolution, and diagnosis of demyelinating inflammatory CNS process. CT scan of the brain show radiological evidence of increased intracranial pressure. So lumbar puncture is not done. But lumbar puncture to do not allow to delay antibiotic and CSF examination should include all white blood cell count, total protein, glucose, gram stain, and microbiological culture. Contraindication lumbar puncture absolutely where presence of intracranial pressure. With the lumbar puncture for child, for adult, and CSF findings, we see if bacterial since more than 1000, viral less than 1000, tuberculosis less than 500, and glucose reduced in bacterial and tubercular infection. Protein also increase bacterial, viral, and tubercular. Culture if positive, bacterial, if tubercular positive. And differential diagnosis bacterial, viral, meningitis, uncommon some Behçet syndrome, benign recurrent lymphocytic meningitis, central nervous system abscess, drug induced, and human immunodeficiency virus, leptomeningeal carcinosis, Lyme disease, neoplastic meningitis, neurosyphilis, parasitic meningitis, SLE, tubercular meningitis, vasculitis. If the blood culture lumbar puncture uh, is no, so dexamethasone empirical antibiotic. If yes, CSF finding bacterial meningitis, so positive CSF gram stain need dexamethasone target antibiotic microbial therapy. If patient is shocked, sign of shock, immediately need bolus 20 ml per kg normal saline, 1 bolus, 2 bolus, third bolus, and immediately if not controlled, not stabilized, need to intensive care unit. Intravenous ceftriaxone immediately and to send the blood for culture and blood for other investigation. If dexamethasone is tried to give 4 hours within the first dose antibiotic. And different complication, cognitive impairment, academic limitation, spasticity, paralysis, deafness, seizure disorder, focal neurological deficit, cardiovascular failure, seizure, mortality, and hearing loss. World Meningitis Day 24 April. Prevention of meningitis, keeping up-to-date vaccine, best defense against the meningococcal disease. And prevention of meningitis in child, this hip, measles, mumps, polio, pneumococcal vaccine. Prophylaxis patients who are contact with the meningitis, the rifampicin, quinolone, ceftriaxone, is less than or older than 1 month, 2 days antibiotic. Adult 2 days, ciprofloxacin, ceftriaxone. Watch. Thank you for watching. Please subscribe, share, who love you for well-being of mankind. Thank you very much. Assalamu alaikum.